But first, British scientists have found an alternative method of administering radiotherapy that could revolutionize the treatment of breast cancer. Researchers from University College London have found that giving patients a single targeted dose of therapy inside the affected breast during the cancer operation is as effective as the conventional treatment, which requires multiple doses over a number of weeks. Professor Jayant Waija has worked on the research for the last 20 years and led the team involved. He told me how the new treatment is different from the way radiotherapy is normally applied.
The way it is similar is it is radiation, and radiation kills cancer. How it is different is normally conventional radiotherapy is given from outside the breast. So it needs to make sure that it's not toxic. So they have to give it in multiple doses. So it is given in every day, Monday to Friday, for 3 to 6 weeks. But this dose is given from within the breast as a spherical ball applicator, which goes in the place where that cancer was, and it's done within 20 to 30 minutes, and during the same operation where the cancer is done under the same anesthetic. And because it is so focused, you can give all the necessary radiation in one go. And it comes with many benefits for the patient. So it is so much more convenient, and in 4 out of 5 patients, they will not need to have any more radiotherapy. And they have fewer side effects, less pain, and better cosmetic outcome.
How much of a game changer in the treatment of breast cancer could this be?
It completely changes the management in a large proportion of patients with breast cancer. Those who are having a lumpectomy with the usual type of breast cancer are suitable for this. And people around the world have already, the first adopters around the world have already started using it based on our previous results. And around the world now there are about 260 centers. There are about 80 in US, 60 in Germany, and so on in the Far East. And there are about 45,000 patients who have already had this treatment. So now, with this robust evidence, I expect it will get much more widely adopted.
How soon could it be rolled out more widely?
It doesn't require much effort. The training is straightforward, and it could be done once the hospitals equip themselves with the machine. And strangely, this is a new treatment which has benefit for the patient, but it is less expensive for the healthcare system. So it should be possible to roll this out, and that's what the focus should be, to roll this out in every place where breast cancer is operated on.
Professor Jayant Waija from University College London.
Times Radio. Times Radio Breakfast with Asma Mir and Stig Abel.
Good morning to you. A single targeted dose of radiotherapy could be as effective at treating breast cancer as a full course. Researchers at University College London say people who received the shorter treatment were also less likely to die of other cancers and heart disease in the following 5 years. But cancer specialists have raised concerns about the study's methodology. Joining us now is the lead author of that study, Jayant Waija, who is Professor of Surgery and Oncology at UCL. Good morning to you.
Good morning.
How does this process work?
It works. It's very simple. When breast cancer is operated upon, you take away the cancer with a small normal tissue around it. And at the same time, during the same operation, we give radiotherapy to the tissues immediately surrounding the areas where the tumor was.
And
so it takes about 20 to 30 minutes, and it radiates the tissues which are at the highest risk of cancer coming back. And now, with this long-term robust outcome, the highest level of evidence, we have shown that it works as well as standard radiotherapy, which normally takes place after the operation every day for 3 to 6 weeks.
And that process, that 3 to 6 weeks process of radiotherapy, I guess that's not ideal for the patient. That makes the patient feel very unwell. It's not a good experience for the patient.
Well, they have to go every day to the hospital, and sometimes some hospital could be quite far away from their homes, and it is more costly to the healthcare system. And importantly, giving radiotherapy during surgery avoids the side effects of radiotherapy.
Really? No trial's perfect, obviously. There's a statistician at the Institute of Cancer Research says that there were methodological and analytical weaknesses. That's a quote in your study. Is that true?
If they see the new paper, they will see these are very long-term results, and it has been very carefully analyzed and robustly and rigorously peer-reviewed. And there is really no No doubt about the data at all. Every possible way you analyze it, we get the same answer. So, and the point I think some people can find difficult to understand is that this was a risk-adapted design in which patients were randomized to have standard radiotherapy, the new treatment, intraoperative radiotherapy, and we had expected that about 20% of them will, after the operation, be found to have type of tumor or the stage of the tumor where we would like to give whole breast radiotherapy as well. So they would get whole breast radiotherapy as well. So it was risk-adapted approach that was being tested, not just intraoperative radiotherapy.
And the result, therefore, you feel is more robust. If this is it now straightforward that if this is such a robust study, this is cheaper for the NHS, it's better in terms, or at least as good in terms of outcome, and it's better in terms of the quality of life for the patient. Is this something that could be rolled out universally?
It should be, because NICE has already given recommendation for it to be used in those centers who had the machine. That is when the earlier data was available. With that earlier data, around the world, there are 260 centers already using the treatment. And they find that 45,000 women have already had this around the world. So it is being rolled out all over the world. And I think it is time it gets rolled out in our NHS as well. I think with these data, there should not be any hesitation in making that happen.
And in practice, how much of a big deal would this be for the treatment of breast cancer? If this were to be universal across the whole NHS, how significant a step is this?
It would be quite a significant difference to women with breast cancer, and it would be applicable to a large proportion of women with breast cancer. So I think it would make a big difference, because they would finish them all treatment during the operation in 80% of the times. So, and less side effects, less pain, better quality of life. And we found a statistically significant fewer deaths from causes other than breast cancer as well.
Why is that? Just finally, that's an interesting point, that it's as good at treating breast cancer, but is it because radiotherapy done more broadly can cause health problems in and of itself?
Probably. That has been shown in other studies as well, that the stray radiation on the heart and the lung and esophagus can cause harm. And that is probably the reason why it has been found. This is a randomized trial, and this is the data we found.
Jayant Vijay, thank you very much indeed. Professor of Surgery and Oncology at UCL. That's an amazing development that we were just hearing about. We'll be speaking to someone after 8 o'clock about her experience of having this treatment. She's had this treatment, and she can tell us what it actually is like. Now, the time is 6:24 in the...
Now, a single targeted dose of radiotherapy could be as effective as treating breast cancer as a full dose. That's according to a long-term study. Targeted intraoperative radiotherapy involves a single dose of radiation inside the breast immediately after the tumour is removed. The study's lead professor is Jayant Vaidya, who joins us. He's with the University College London. Good morning to you, Professor. Can you describe, first of all, what you mean by targeted intraoperative radiotherapy, or TARGIT IORT, I believe it's called?
Good morning. TARGIT IORT is a method in which, after the cancer is removed, we insert a spherical applicator in the place where the tumor was in the breast. And this is done in the operation theater under the same anesthetic. And it takes about 20 to 30 minutes. And it gives radiation to the tissues which have the highest chance of the cancer coming back. And it doesn't go far. So it doesn't radiate organs such as the heart and the lung, which are close by. And that is all the radiation that we have now shown at the highest level of scientific evidence is as good as in controlling the cancer as standard radiotherapy, which normally takes several weeks.
And I understand you began trials in 2000. How many people in that time, how many human trials have you done to know that this is as effective to stop the spread, if we're talking about over the past 20 years?
So this is one of the largest randomized trial of its type. So 2,298 women were randomly assigned to either have this treatment or have the standard treatment. So half the women had this treatment and half had the standard treatment. And importantly, we have now followed up and monitored all these women for all this time. So our follow-up time on average is about 8.69 years, and maximum is 19 years. And that is where we are certain about its robustness.
Because, that's where many people would say, but, it takes a while to know whether somebody may have a relapse or a recurrence.
Indeed.
But you seem very confident this can work. If you're so confident, and with what you're saying, this is, revolutionary, saving people's lives and saving them from having a relapse, why is it then not being planned to roll it out widespread across the NHS here and in other countries too?
Well, it has actually happened. It doesn't save lives. The deaths from other causes are statistically significantly fewer, and breast cancer deaths are no different. So it reduces the toxicity of radiotherapy. Now, around the world, there are 260 centers. And in these centers, there are 80 in America, US, there are 60 in Germany, there are many in Europe and Far East. And about more than 45,000 women have already had this treatment. So people who have seen our previous results have already started rolling it out to their patients. It's there in many national and international guidelines, and our own NICE recommended it in those centers who already have the equipment. And with these new data, which is the long-term follow-up, which is what is required for breast cancer, because it can come for a long time. Now that we have this data, there should be little delay and in implementing this in the NHS. And every hospital who treats this should have this option available to them.
Professor Jayant Vaidya from the University College London, thank you so much for telling us about Target IORT.
A new treatment for breast cancer patients is described as a breakthrough by the Times. The study, published in the British Medical Journal, found a single dose of radiotherapy delivered from inside the body is as effective as weeks of the treatment. Doctors at University College London says the therapy is given immediately after a tumour is removed when the patient is still under anaesthetic, so avoids multiple hospital visits for traditional radiotherapy.
You have the opportunity to change. Times Radio. Know your times.
Times Radio Breakfast with Asma Mir and Stig Abel.
It's 8:54. A single targeted dose of radiotherapy could be as effective as treating breast cancer as a full course. Researchers at University College London say people who receive the shorter treatment were also less likely to die of other cancers and heart disease in the following 5 years. But cancer specialists have raised concerns about the study's methodology. We're going to speak now to radio presenter Kirsty Lang, who received this treatment. Hello, Kirsty.
Hello, Asmir. Hi.
How long ago was this?
I had the treatment 4 years ago now, after being diagnosed with a small but quite aggressive cancerous tumour in my left breast. And the fact that it was in the left is quite significant because it's over your heart. And when I was first diagnosed, I was told that I could face, after the operation, 4 to 6 weeks of external beam radiotherapy, which is a standard treatment. Now, that would mean going into the hospital every day, 5 days a week, for up to 6 weeks. And I was a freelance journalist, so that's a lot of time, and I would have lost work, and it's also very tiring. And then I heard about this treatment, and I was fortunate enough to have private health insurance through a previous employer. So I was able to get it. But it struck me at the time that it was incredibly unfair that I was able to access that, because it meant that I went into hospital. I had my tumour removed. While I was under general anaesthetic, I had half an hour of targeted beam radiotherapy into the tumour bed. Then I was kind of sewn up, went home that night, and I was back at work a week later. And it also meant, I mean, if you don't have to be a scientist to figure out that, 6 weeks of external beam radiotherapy over your heart is possibly going to cause you long-term damage. And I'd say one other really important thing is that for women who live in rural areas and have to drive sometimes up to 2 hours a day to get their external beam radiotherapy, and if they're carers and they have, children or elderly parents or an ill relative at home, it is a big chunk out of their lives. And quite often, women make the terrible choice to have a mastectomy instead, rather than face that.
Well, absolutely. I mean, 4 to 6 weeks, that is a huge period of time. And if you're going through it every day, it must be really wearing. What has happened to you since, Kirsty?
Well, I'm very well. I get regularly checked up. I mean, I find it very, very surprising to hear that well, actually, I don't find it totally surprising to hear that some members of the medical profession are saying this study isn't gold standard. It's completely gold standard. It's 12 years. It's over 2,000 women. It's a number of different countries. It's nonsense to say it isn't gold standard. I mean, I was quite interested as a journalist when I started to look into this therapy. I couldn't understand at first why there was some resistance. And then I realized, of course, that radiotherapy units across the country, early stage breast cancer patients account for something like 20% of their intake. So there are vested interests at stake. If women only have to have one shot, there's that. Also, the machinery is, quite expensive. Hospitals would have to kit it out. It needs a special machine that's made in Germany. But let me just say this. It was a British invention. This was a British discovery developed in a publicly funded British hospital, University College Hospital, and it is standard treatment now in countries like Germany and the United States, but it is not here. It's available in a very, very few places. I think, maybe 4 or 5 hospitals that have the machine that took part in the original trial, as far as I know. And that's not fair on women. It is not fair to put women through a postcode lottery. I feel very fortunate that I was able to have this treatment. I'm very grateful to the doctors who invented it.
And we are glad to hear from you and to hear that you're well. Kirsty, thank you very much. Nice to speak to you. That is the radio presenter, Kirsty Lang.
It's one of those rare good news stories, but it would be extraordinary if this wasn't put across the NHS immediately, because it must be, it might affect the incomes of some providers, but it's going to cost less. It's going to damage people less. And I felt this morning that was a good news story.
Yeah,
and
absolutely.
It sounded like it was...
at last, a good
Kirsty.
news story.
Yeah, exactly. We're going to be talking the last hour of the show to some more GCSE students who've had their grades today. Have they been inflated? People have been texting in all morning about this. Regrade inflation. In a class of 30 kids, you were confident of the grades that...
Radiotherapy is a common treatment for cancer, but it can take its toll on those battling the disease. Now, a study suggests a single targeted dose of the treatment could be as effective as treating breast cancer as a full course, which can require up to 30 hospital visits. Ross Hanlon from Glasgow has had breast cancer twice.
The first time I had it was 2001, and it was during my dissertation year, and that's when I got radiotherapy. I think it was a course of 6 weeks every day except the weekends for 6 weeks, I think. That was horrendous because although at the beginning, the first few days, it was okay and I thought, oh, this is no bother. And then the tiredness came, then the skin burns came, the pain, and I just felt awful for quite a long time, all through my radiotherapy.
And what's the situation now then with you as far as your health is concerned?
Well, I had breast cancer again on the same breast 10 years after, so that was 2011. I didn't get any radiotherapy because I had already had radiotherapy in that same breast. So since then, I've been absolutely fine. I was fine after the first breast cancer. I was absolutely fine.
So the news today that's coming out, or the research certainly that has been done, is suggesting that it could be effective just to have one blast of radiotherapy. Yeah. How much of a difference would that have made to you?
It would have made a huge difference in 2001 because, as I say, it was during my exams and my dissertation, and it was like really as if my whole life had to stop for 6 weeks. It was so difficult for me. And I think that even if I had one of, and maybe the after effects maybe lasted a week or a fortnight or whatever, I could have coped with that. But this just went on and on and on. And I think somebody who's in a situation like that, where the time frame is really important for your life, really, I think it would be fantastic if somebody had offered that to me.
Let's speak now to Professor Michael Baum from the University College London, who co-authored this study and helped develop what's known as targeted intraoperative radiotherapy. Thank you very much for joining us, Professor. Now, I've just said that once. I'm not going to say it again because it's a mouthful, but can you explain to us exactly what that means?
That lovely lady described her medical history, and it is fairly typical. And the reason we launched this trial in 2000, that's nearly 20 years ago, was because of experiences like that. We chose to look upon it from the patient's point of view rather than the convenience of the radiotherapist. And we embarked on this trial with over 2,000 women, where we were comparing the conventional treatment as described by that lovely lady with a novel device that we'd invented where you can deliver radiotherapy into the tumour bed at exactly the same place where the cancer had just been removed, and it takes about half an hour to deliver that dose, and that's it. So it was a very bold conjecture that this could be equivalent to whole breast radiotherapy, but there had been a lot of biology and science, physics, before we had the courage to do the study. And here we are, 20 years later, with a long-term follow-up, which shows that our novel therapy is equivalent in preventing local recurrence, in preventing distant recurrence, in avoiding the necessity of mastectomy, and equivalent in breast cancer-specific mortality. But, and here's the big but, the most important unexpected observation, it actually reduces deaths from other causes, which may be the toxic side effect of radiotherapy. People overlook there is a small but significant toxic side effect where the radiotherapy can damage the underlying tissues, like the heart and the lung.
And I'm sure many people are in the situation of Roz where they might have been through this, or they might be going through something like this, a course of radiotherapy, and they'll be wondering when this could possibly be available to them.
Well, a lot. The data are there. The NICE approved it some years ago. It doesn't lie with the scientists now. It's up to the local health authorities, National Health Service Scotland, National Health Service England. They will have to acquire the equipment. But I'm so glad to be speaking to you because the pressure's got to come from the patient, the client. It costs to purchase the equipment is an initial cost, but there's a long-term saving in the use of radiotherapy centres. I would love to see a campaign. What was the name of that lady who spoke?
That was Roz Hanlon.
Well, someone like Roz and people like her with that experience should be campaigning on behalf of the other women who are going to get breast cancer, demanding that this service be made available in all hospitals that are caring for breast cancer. So the pressure, I think, has got to come from, we don't call them patients yet because they're not patients, to pressurize the purchasing authorities of the local health departments to get this equipment.
OK, thank you very much for your time, Professor Baum. We really appreciate it. Thank you. Now, for anyone returning to Scotland from countries...
A British long-term study suggests that a single targeted dose of radiotherapy for breast cancer could be as effective as the conventional method of treatment, which involves multiple doses over several weeks. A small device is placed inside the breast during surgical treatment immediately after the tumour is removed. Some cancer specialists have raised concerns about the study's methodology. Professor Jayant Vaida, from the team that developed the treatment at University College London.
Because it is so focused, you can give all the necessary radiation in one go. It comes with many benefits for the patient. So it is so much more convenient. And in 4 out of 5 patients, they will not need to have any more radiotherapy. And they have fewer side effects, less pain, and better cosmetic outcome.